Clinical decision support systems are an incredible way to heighten the quality of care delivered at each site of service. We have 176 sites of service in my practice, and so there are doctors that have subspecialty expertise and others that don't. By having a clinical decision support system to facilitate compliance with chemotherapy prescribing in accordance with NCCN guidelines and value-based guidelines, a program called Clear Value Plus, we're able to facilitate guideline adherence. We not only facilitate guideline adherence at point of care, because as I sit in a room with a patient, I have clinically appropriate choices in front of me based on the data that's entered into the system on the patient disease. I then am facilitated, I'm nudged to order guideline compliant chemotherapy choices. I don't have to. There's an exception process if warranted that you can go through an exception, but then it facilitates my compliance. And so what we've done across our 420 physicians is we track compliance with those quality metrics, and we give them that feedback so they can see how they're doing, how their colleagues are performing in terms of their compliance with that guideline. And that's a quality metric of cancer care. We know that on average, patients are better treated when they're treated in accordance with guidelines. And so that's something that has really evolved in our practice over time. And because it's a clinical decision support system embedded within the health record, I don't have to think about it. I don't have to look it up. That's external knowledge that's brought internal at the time of point of care when I'm sitting in a room with a patient making decisions about their care delivery.